Namaskar and a very warm welcome to this edition of our program Let's Talk Health, Psychiatry and Neuromodulation Queries. I'm Nidhi Kumar and you're watching India Science. Well, India's cumulative COVID-19 vaccine coverage exceeds 186 crores. India has reported 2,183 new COVID cases. More than 2.6 lakhs vaccine doses have been administered in the last 24 hours. And the recovery rate is currently at 98.76%. As COVID-19 continues to surge across the globe, we are having some queries and people are speculating about health problems. We get you queries on psychiatry and neuromodulation today. In this program where we take your questions from Facebook and YouTube Live, we are joined by the very well known Dr. Nand Kumar, Professor of Psychiatry and Neuromodulation at the All India Institute of Medical Sciences, Delhi. Many thanks for joining us, sir. Welcome to India Science.
Good afternoon. Good afternoon, everyone.
Afternoon, sir. Doctor, please tell us about how you would term anxiety disorders.
Okay. See, the COVID-19, as you very rightly mentioned, no, COVID-19 pandemic was something very uncertain. So anything that is uncertain can precipitate anxiety. But let me just make it clear. Like, anxiety is not an abnormal condition. No, anxiety is this kind of thing. It is something like blood sugar. No, we have all blood sugar, say between 80 to 100, it is a normal sort of blood sugar. If it increases, it becomes troublesome. Decreases, it becomes troublesome. So some basic anxiety is very, very important to work, no, and to perform. If we don't have the anxiety, no, we won't be able to perform. If you don't have the anxiety, you can't, no, pick up your train and you can't catch the flight also. So some anxiety is important. Now, the trouble is there when anxiety comes too much. So, what we call as a no medical professional. So, when anxiety becomes too much, that means ki there is a overactivity of some set of nervous system. That is what we call autonomic nervous system. And if there is activity, increased activity of that autonomic nervous system, that leads to increase or intense anxiety. And commonly, the symptoms of anxiety are no palpitation, lot of excessive thoughts, little restlessness, sweating, and difficulty in falling asleep, poor concentration, pacing in the room. If you're a student and not able to concentrate, so we call it disorder. No, so in the COVID-19 pandemic, the things were quite uncertain, so that lead to a lot of increased anxiety. And if anxiety continues for longer time, then it may lead to several other conditions, like as I mentioned, it may lead to increased blood pressure because there is a increased autonomic tone of nervous system, in fact, in the body, and that leads to increased blood pressure, tachycardia, and at times also breathlessness. That also leads to gastritis. So, increased anxiety can lead to any kind of gastric symptom, neurological symptom, and no, the depression, the headache, pain in the nape, and the backache. So, a lot of symptoms can be there.
Doctor, during the pandemic, there have been multiple cases of behavioral and emotional disorders in children. If we talk largely about children, can you tell us more, especially adolescents? Could you give us your insights on the same?
During the pandemic, in fact, if you look back, no, the most troublesome life the children had, because the adults, they would afford to go out, meet people, and they had some sort of social interaction. But children, it was perhaps very, very difficult. The schools got closed. The schools, no, they were not going to the school. Social activity almost nil. No scope of going out, meeting friends, no scope. In fact, they try to catch up with online mode of the little bit of education and interaction with the the friends, but that also was not perhaps adequate, and at times it boomerang. So the adolescent and these children, they had some behavioral issue, in fact, and those behavioral issues were mainly the anxiety. And anxiety, as I mentioned, this was because of uncertainty. No, if anything that is uncertain, you are not sure about something like that is going to happen, for how long the school is going to be closed, when I will be able to go out. So that leads to anxiety. So the most common manifestation was no the poor concentration, lack of sleep, and if there is a poor concentration, lack of sleep, not meeting people, decreased social interaction, and that led to irritation, anger outbursts, a behavioral issue. But some people manage it very well, and but most of the people could not manage it because it is not always bad. In fact, no, in some family, what we have seen that the children were happy. In fact, in the beginning, because they realize that parents are at the home and they don't have much restriction because parents also did not have much to do, and they were not going outside. So there was a mixture of symptoms, but mostly at the no once the COVID pandemic progressed, we observed that a lot of anxiety, headache, sleeplessness, irritation, mood changes, difficulty in study, that we have noticed.
So these are termed as behavioral disorders. Now coming to schizophrenia, can you please explain this term for the benefit of our viewers with examples, sir?
Before I go to schizophrenia, no, what we have observed that some children they developed a lot of no attention issue. They're not able to study. But if you talk about behavioral disorder and clinically diagnosable behavioral disorder, then those are different, and those are basically attention deficit disorder, in which the child is not able to have a sustained attention. They're not able to study for a little adequate time. Then there is something called oppositional defiant. So the child would do an act exactly opposite of what no you were saying, in fact. And that creates a lot of issue conflict between the family and the children. uh, at times, no, in COVID, in terms of disorder, we have seen the obsessive compulsive disorder because no, lot of focus was there on washing the hands repeatedly. So that led to some sort of obsessive compulsive behavior. And in obsessive compulsive behavior, there is a fear of contamination that kept on washing it, beyond a point, in fact. Coming back to your question, look, schizophrenia. Schizophrenia is a serious, brain disorder. Why I say brain disorder? Because it it is because of the some change in the chemical structure and physiological functioning of the brain. In schizophrenia, what happens? There is a misinterpretation and misperception of some stimulus. Say, for example, no, uh, you are talking to someone, and what you are talking to someone, the person is not able to have the adequate sense of that particular conversation, and they misperceive it. Some people may hear the voices that is actually not there. Some people develop very suspiciousness sort of thought process. So suspicious in the sense, suppose you are going out and you feel that people are talking about you, but actually they are not. If you go to the office, you start having the suspicion and fear that people are looking at you, they are conspiring against you, but actually it is not there. So it is no, the evidence is not there, but in contrary to that, you develop a fear, you develop a suspicion, and that is mainly because of the misperception of any stimuli that is no even auditory, visual in the sense you are looking at something, but you are misperceiving it in a different way. Suppose if I'm writing with a pen in front of someone who has perhaps a symptom of schizophrenia, the person may perceive that this pen has a camera, but actually there's no camera. In fact, the person may perceive, in an abnormal way that I am writing something against the person concerned. So it's a serious medical condition, but important thing is it is a in a good number of cases. approximately say 30-35% people, they respond very well to medication. And we have very good medication to treat schizophrenia or illness like schizophrenia nowadays. And these medications are safe, they require some monitoring, but the response is quite good. But unfortunately, some people know, say for example, 30% or so, they don't respond adequately, and the condition may worsen. But overall, no, if we start treatment earlier, in case of children also, in case of early onset schizophrenia, the treatment outcome is quite good.
What is bipolar affective disorder? If you can explain this for our viewers, sir.
It's a not uncommon disorder. See, as the name no stands, bipolar means two pole. One pole is very feeling very low, very sad, lack of energy, decreased confidence. You are not able to talk to people because of low interest, and it is extreme lethargy, in fact, and either too much of sleep or lack of sleep, and there is a no lack of living the life, in fact lack of moving ahead. So there is a no kind of despondency, this severe depression sort of thing. So there is a very very low mood, in fact. That is one pole. Another pole is opposite of this. That means there is increased no activity, the mood is very elevated, you feel very good, you feel very happy, in fact. And even one small trivial issue you feel very very happy. And even without any reason for happiness, your brain becomes so active that you feel very glad. And once you feel glad, very happy, what happens? You would like to move, you would like to meet people, you would like to spend money also without perhaps any no adequate reason. You would like to do a lot of shopping that may not be required. And you will have lot of confidence. So you can you may have some big thoughts in your mind that is not rational. So, for example, we have seen the people know uh, they take a very bad decision, in fact, when they develop a very very high confidence. Something like selling out the property at very low cost, or giving something away to the people, some precious thing. Because the too much of confidence, then people become so generous. When the mood is very elevated, no, it is very high. At that time, the lack of sleep is also there. People don't feel the need of sleep. They don't sleep, but still they feel very very fresh. And when it becomes too intense, no, too intense elevated mood, then that may turn into perhaps what we call very disorganized kind of behavior, like no what we call psychosis. So it's a two poles of this, no. But it is very important to understand that some people who are not having intense bipolar, not having very severe bipolar, and there is some mood fluctuation that affect functioning very badly, they do very good in the life. And we have seen that people who are having no soft bipolar, so there is some mood fluctuation, they can do remarkably well. Perhaps they can do better than quote unquote who are people know what we call normal, and they are the achiever. In fact, this is what we have seen clinically. But at times, no, uh, the depression becomes severe, but we can treat it. It is a highly treatable condition, and the most important thing in the treatment is no, the person should be able to accept it that okay, it is an illness, and we can treat it through medication and through lifestyle changes also.
Yes, doctor. We have a YouTube question now from Shivam from Ghaziabad, and he wants to know about neuromodulation in mental health practice. What is it, if you can tell us and elaborate on what it is, and then we'll talk about the treatment of this later, sir.
It's a very good question, Shiva. In fact, neuromodulation, no, as the word reflects, it's a modulation of neurons, modulation of any neurons. So we can modulate our neural system by either lifestyle modification, by some lifestyle changes, by exercise, by breathing, by yoga, or by some no mechanical neuromodulation also. For example, if we are having lot of mood changes, lot of mood shift, and we are having lot of anxiety, or we are having the panic attack, so we can modulate our autonomic nervous system, no? And this autonomic nervous system modulation can decrease the intensity of panic attack. It can minimize, it can treat, it can perhaps cure also, no? But it requires lot of practice of modulating our autonomic nervous system. Similarly, no, if there is some issue and you are not able to perhaps do that neuromodulation physiologically, and the person is not responding to physiological neuromodulation, say for example depression. In depression there is a low mood, you don't feel like going out, there is a lack of interest, there is a no thought of worthlessness, helplessness, decreases, at times thought of self harm and suicide also. So in this case, what actually happens if you look at the brain? So there is some decreased activity in the prefrontal part of the brain. No, say for example, left prefrontal part means no. Here it could be there is a decreased activity. That means the metabolism of that part of the brain that process the information that becomes very slow. And through neuromodulation technique, we can enhance that metabolism or we can modulate that metabolism. One approved one is magnetic brain stimulation. It's a painless, non-invasive process. So there is no pain, no anesthesia is needed. You can come to the clinic or you can go to any clinic. You can ask the doctor. They will calculate how much magnetic doses you need to have, and they can modulate very certain part of the brain, where activity is low. That is what we call neuromodulation. There is a huge scope of neuromodulation in psychiatry or mental health, because we can modulate any part of the cortical neurons that is accessible, in fact, from the outside. We can treat depression also. Now, recently, we can treat some symptom of schizophrenia not responding to medication, what we call symptoms close to depression. That is what we call negative symptom. Means the person is withdrawn, not no, not speaking, not able to move, and there is a complete lack of interest in all activities. There is a complete lack of volition. So in those patients, this is very very effective intervention. This is our experience in the institute. In fact, other thing is like no in a stroke when the person develop depression and the person is not responding to medication, what is we call vascular depression. Then neuromodulation technique we use to treat those kind of depression in some patient. One more important condition is obsessive compulsive disorder, OCD. In obsessive compulsive disorder, if the person does not respond to medication, a good number of patients respond to neuromodulation technique. So it's a very useful technique, but I must emphasize on that the neuromodulation is very broad, wide term. No, we can do physiological modulation, neuromodulation by lifestyle modification, like exercise. If you go for walk, run, that is also modulating your nervous system and cardiovascular system.
Right, doctor. Very well said. We'll come to neuromodulation techniques yet again because we have viewers joining us all across the spectrum. But meanwhile, please tell us about depression and suicide and how they're related, and even disassociation and dissociative disorders. How do you spell out these and what do they imply?
Association. It's a You want to know about dissociation?
Yes, sir. Depression and dissociative disorders.
So, depression, no, if you say it's a emotional disorder, and the sadness and depression is a little different. Like sadness is a normal emotion. We all feel sad at some point of time, no? Even during the day, also we feel at times sad. We feel at times, very cheerful also. But this sadness is normal emotion. It lasts for a short time, maybe for a few hours to few days. Suppose there is a loss of life, in the family, you become sad, and there is a grief reaction. reaction. So that's quite normal. But at times, so what happens if there is a sustained sadness? No, mood is not reactive. You are remaining sad for at least 2 weeks. But with this sadness, there is also associated symptom like lack of interest in other activities. No, there is a decreased energy level. You feel fatigue without any work. Also, there is a either lack of sleep or there is a no too much of sleep. You feel that life is not worth living. Everything is there, but no, you don't feel like doing anything. In fact, you feel like no that you should be staying alone, and at times there is also crying without any reason or on very trivial reason. And if it lasts for 2 weeks with plus minus no uh, thoughts of helplessness and hopelessness, that nothing, no one can help me, in fact, and then it lasts for 2 weeks, at least more than 2 weeks, then we call it depression. Now, in terms of suicide, suicide is a complication. It's not a basically it's not an illness, but suicide is a complication of depression most commonly. But suicide can be there for so many reasons. Like depression could be one of the most common reason. Suicide can be there in the schizophrenia also, when the people become very suspicious and very fearful, they make take their life. Suicide can be because of the so many socio-economical and cultural issue also, like the very shift in cultural thing and shock, and we are not able to cope with the circumstances situation. Then this is a complication. What happened? Unfortunately, we have seen the rise in the suicide death in the last 1 year, in fact, and that this is because of the uh, lot of other issues like financial issues, then the some social and structural changes, then leading to depression or adjustment disorder. And one of the more common reason that we are observing nowadays, a lot of family conflicts, and these family conflicts lead to adjustment disorder. People are not able to adjust, and that leads to some sort of subclinical depression leading to suicide. And impulse plays very important role. And if there is a add-on effect of alcohol and some other drugs, there is a more risk of suicide. So my suggestion would be to now, like, if any person who are having the suicidal thought for any reason, either issue in the family or academic or social reason, they should at least talk to someone who can listen to them, or if required, they can go to the doctor at least. No, the very strange thoughts that comes in the mind is what doctor is going to do in this case. Say for example, no, I have huge financial crisis, so what doctor can do? But the important thing is the financial crisis is now at this point of time, but no, it may not be there after a few months. So you have to sustain the life, and if you are able to take the better judgment, then perhaps you can manage well that time also, and life can be saved. Then if I come to dissociation, no, so the name itself suggests there is a dissociation between emotion and action and thought process. There is a dissociative phenomena. Uh, Dissociation is not uncommon. It is common in depression also. It is common in anxiety also. So what happens when there is a intense anxiety and one person is not able to handle that anxiety? So the bodily function and that no the emotional, there is a dissociation between two phenomena. Say for example, somebody has to go for examination, appear in the examination, and the person has a feeling that he has not read at all, and the mind is blank. So there is an intense anxiety, and what happens because of intense anxiety, the person may become unconscious. So that is not a seizure. The person become unconscious, no, the unresponsive, and they're not doing it deliberately. So it is a basically some sort of no involuntary stress relieving phenomena. It is important to note it is involuntary, not voluntary. So most of the people think that somebody is feigning it, somebody is doing it deliberately to know escape from some situation. No, It is because of the intense stress that brain is not able to handle, and that leads to lot of dissociative symptoms. Like the example I have given, the person can be unconscious for some time.
Right, doctor. Coming on to the next question, I'd like to ask you, and this is about delirium and neurosis, and what kind of medication can be taken?
Delirium is basically a condition. That means that there is some pathological factor that make a person disoriented and no fearful and fluctuating consciousness. So in delirium, the commonly used medication is no, that first we need to stop all the medication that is causing delirium, and investigation has to be there. Then to control the behavioral part, we use very low dose antipsychotic like haloperidol, risperidone. But of course, that must be under doctor's supervision because dose is very, very important. How much dose should be given, the doctor can decide. Neurosis is something very different, Neurosis is something like it is related to the neurons, and it is a very old word. Now we don't use that word neurosis, in fact, because neurosis means linked to neurons. So that means, clinically speaking, the person is very anxious. There is a lot of pain and act, headache, body ache, and a lot of anxiety related to those symptoms. So this is what we call neurosis. But neurosis, clinically and technically, is we are not using this word more since last few years.
Right, doctor. We have a YouTube question now, and this is from Ananya, and she writes to us from Delhi. She says her uncle is taking antipsychotic medication. How could you possibly monitor him for depression? People become compulsive medicine takers as well.
Thank you. Ananya, it's very important. The person who takes antipsychotic medication, the antipsychotic medications are very helpful medication if someone has a psychosis, and they're good medication, in fact. But unfortunately, if it is not being tolerated by the person, if somebody is not tolerating it, then that lead to some side effect, and this side effect looks like depression. Say for example, in some patient with antipsychotic, the person become little withdrawn, become little slow, the movement is slow, and there is a slowness of expression also, so that looks like depression, and there is a slow walk also. So it is important to differentiate that, because once you taper the dose of antipsychotic, or once you give some medication to counter those side effects, if person is doing well, then you can manage well the antipsychotic. Now to differentiate between this antipsychotic induced symptoms that look like depression and actual depression, the mood is important. If the person is expressing the sadness, and then loss of interest in lot of usual activities, then that reflect that depression could be there. But if the person is not expressing that sadness, that may reflect that it could be antipsychotic induced some mood changes. But it's very important to differentiate that by the doctors also, so that we can avoid that unnecessary use of medication in some patients.
Yes, doctor. I'd like you now to spread some light on paranoia and also on dementia, because we have hardly any time left, sir, and so many questions are pouring in. If you could throw some light on both these.
Paranoia is a very interesting phenomena. It's paranoia means there is a suspicion without any substance. Say for example, I have a suspicion that my no girlfriend is having some relationship, but there is no evidence. It's a quantitative to the evidence. Any paranoia is something like, no, in the family people are talking about me, but actually they are not talking it, and usually in negative sense, negative connotation. In the previous years, paranoia, most of people would have paranoia in the sense that somebody is controlling them through any mechanism. But no, now the paranoia, these paranoia were the part of some syndromal diagnosis like schizophrenia. But no, with advancement of technology, in the recent time, the some paranoia that what we would consider pathological, perhaps that is no. It's difficult to say that person is having paranoia or not. But clinically speaking, if somebody feels that they are having the doubt, even if somebody feels that they are having very strong belief system that's no, they are being harmed and they are being followed, or somebody is conspiring against him or her, then they should be cautious, and there is no harm in discussing with other people. No, because at times it happens that this paranoia becomes a belief system, and when this becomes a belief system, and that is against no the social and cultural norm, and it's a very false belief, we call it delusion, and it's difficult to treat at times. So even when there is a small suspicion that if somebody says that no, you are becoming suspicious, आप शक्की हो गए हो, the person should have some neutral sort of observation or neutral sort of thinking, and they should talk to someone neutral and open to that. That can solve a lot of problem, in fact, in relationship also, in work also, and in social functioning also.
Absolutely, Doctor. And on that note, I'd like to thank you, Dr. Nand Kumar, for joining us for this very, very interesting conversation and for sparing your valuable time in educating us. And with this, friends, this is the wrap of this edition of Let's Talk Health. We'll be back with more interesting questions and more doctors. Until then, get vaccinated, take the booster. That's the only way. Stay safe, keep up the mask. Namaskar. Many thanks for watching India Science.